Shingles is when the chickenpox virus comes back. Most of us get chickenpox or get the vaccine when we're small, and then we develop antibodies that control the virus for many, many years. But under times of stress, or just after enough decades, the virus can kind of rear its ugly head. The difference is, instead of showing up all over the body like chickenpox, it'll usually just show up in a single area called a dermatome. That's an area that involves one nerve. And that's why there can be a nerve that wraps around, let's say, the rib cage on one side of the body, not both. Or a nerve that wraps around part of the face on one side, again, not both. That's shingles. The shingles vaccine is now recommended for everyone over 50. And there are certain categories of people who are immunosuppressed, either because of a medical condition or for treatment for a medical condition, who may be at greater risk. And the jury is still out on whether it works as well, but with the newest shingles vaccines, those vaccines are now often used in those patients. The older vaccines were live attenuated, meaning there was actually a virus there that could invade cells and reproduce itself. The newest vaccine is what's called a recombinant vaccine. So it is instead a series of virus components that aren't actually able to act like a virus. So that makes it a little less dangerous. But the other good news is that the newest vaccine is also more effective. Whereas the prior shingles vaccines were considered to be around, let's say, half to 2/3 protected, it's now 9 out of 10 patients who seem to be protected by the new shingles vaccines. It is a quick shot, although it's a series of 2 shots. You get shot number 1, and then between 2 and 6 months later, you get shot number 2. So you got to plan on 2 shots, and it is a little more painful than the old one. There's more likelihood of getting redness and soreness. At this point, this vaccine is considered to be safer than the old one, and it really is recommended for virtually everyone over 50. If there are people who have sensitivities to the components in the vaccine, they would need to be more careful. So that is something to discuss with your doctor if you've had a lot of sensitivities to components of injections in the past. Shingles doesn't sound like a big deal, and many times it isn't. It's unpleasant. Someone gets shingles around the chest, it's going to hurt. And it can hurt for not only the days and weeks until it's treated and goes away, it can also then cause chronic nerve pain called post-herpetic neuralgia. And it's called herpetic because the herpes virus and the shingles virus are very close cousins. So this kind of chronic pain can sometimes require pills or other neurologic treatments. It's not something to be taken lightly. An even bigger deal, and this is a super important message, is if the shingles involves this middle part of the face, it can invade the upper layer of the eye, and it can cause blindness, permanent blindness, not to mention a tremendous amount of pain. And a very important clue for this is what's called Hutchinson's sign, of blister on the tip of the nose. So anyone, any age, a blister on the tip of the nose is a medical emergency. You've got to get help immediately to figure out what's causing that blister. And is it shingles? Is it chickenpox? Is it herpes? Is it something that requires immediate treatment to potentially save an eye? In my experience, it stayed about the same. It's something that we see pretty often, though, partly because we see a lot of patients who do have immunosuppressed conditions. But also, we'll see healthy young people in their 20s, particularly during a very stressful time of life. There'll be a death in the family, something else very stressful. They'll get shingles. And of course, we see lots of patients over 50 who will say, oh, you know, I'm having this pain here, or oh, I've got this pain here. And we look more carefully and, oh, there's some redness, look, a tiny blister. And we're really glad they came in. We can get the medicines going, the appropriate anti-varicella medicines, and we can prevent this problem. I think getting the word out is going to help, especially when people hear that the new vaccine is a little less dangerous and also significantly more effective. So it's my hope that as the new vaccine becomes more prevalent, people understand it, they use it, we're going to be seeing less and less shingles.